All right, we're joined in the studio now with Dr. Melissa Sparrow, Chief of Staff for GBMC. We're talking about the coronavirus and what you can do. Doctor, thanks for coming over.
My pleasure.
Tell us what GBMC is doing now to protect the folks on the front lines.
Folks on the front and our patients.
And the patients coming in.
So I've been very proud to be part of the operations at GBMC. They have really shown that, and demonstrated their capacity to rise to this occasion. And what they started with is a command center, an incident command center. And the person who is in charge of that at baseline is somebody named Michelle Towson. And so when this epidemic, this pandemic has come into the lives of our citizens in our hospital, we brought forward a bunch of new people to run the command center. So we have our nurse person who's heading it, a nurse leader named Sharon Rossi, and then the CMO, Harold Tucker, is our physician leader, and numerous other people who are taking on all the different portions of the healthcare system that are part of the care of our patients. So you have to think about EVS, the people who clean the hospital, the people who feed the hospital, the techs, the MAs, the doctors, the nurses, and all the people in the background. And there's so many moving parts, so many puzzle pieces to the healthcare system, and each part of the command center is thinking both about how to take care of those people and also how to make sure that they can rise to the occasion of taking care of many, many more sick patients with a much more severe level of illness than beforehand. Our frontline providers have created tents to quickly triage the patients who come in with respiratory symptoms.
So you can't just show up and go to the emergency room?
Well, you will be triaged. So there is a process where you're going to cohort patients who may have the particular virus, and then we're going to be able to see the other patients in another location. That way we're limiting the risk of the patients who don't have COVID-19, and we're able to rapidly see among the patients who have COVID-19, the majority of them who are going to be well enough to go home and be cared for in the home, and quickly and rapidly be able to locate the patients who are going to need intervention and a higher level of care.
What about visitors?
So we have to limit visitors because we have to, of course, keep the visitors safe and keep the patients safe and the staff safe, because the people who are at most risk when there is an epidemic, a pandemic, a surge of patients in the hospital, besides the patients, are the healthcare providers. And if you don't have the healthcare providers, we will not be able to take care of you. And so we are limiting visitors. We are assuring that those patients who are absolutely the most vulnerable, those at the beginning of life, those at the end of life, pediatric patients, they can have a visitor. And in very special occasions, certain occasions, as you know, with everything, there has to be a little bit of gray. We will allow visitors. But in general, we are stopping visitors at the door in order to take care of everybody better.